If you're over 50 and notice your ankles swelling, your skin feeling tight, or deep sock marks appearing by evening, you're certainly not alone. Leg swelling is extremely common, but it's important to remember that it's not just a cosmetic issue. Persistent puffiness, especially the kind that leaves an indentation when you press your skin, can be a sign that your circulation is slowing down or that your veins are working harder than they used to. But here's the good news. Swelling has many different causes, and most of them are manageable once you understand what's happening inside your body. Today, we're going to break down the difference between normal, temporary puffiness and the kind of persistent edema that deserves more attention. And stay with me because halfway through this video, I'll reveal one simple evening habit that silently makes swelling worse for millions of adults, yet almost no one realizes they're doing it. Let's get started. The real reasons legs swell, not myths. Leg swelling can happen for many different reasons, and understanding those reasons is the first step toward managing it safely. Most swelling in adults over 50 is caused by a mix of circulation changes, lifestyle habits, and normal aging processes, not just salt, heat, or long days on your feet. The more you understand what's really happening, the easier it becomes to take helpful action. One of the most common causes is venous insufficiency, which simply means the tiny valves inside your leg veins are not pushing blood upward efficiently. These valves weaken naturally over time, allowing fluid to pool around the ankles. This is why swelling often gets worse later in the day. Inactivity and gravity also play big roles. When you sit for long periods, the calf muscles, which act like a second heart, don't pump blood back up toward your chest. Gravity keeps pulling blood downward, and the fluid eventually settles in your feet and ankles. Salt matters, but not in the way most people think. Swelling is actually influenced more by salt plus hydration balance. If you drink too little water, your body holds on to sodium, and that makes fluid retention worse. At the same time, eating very salty foods can increase puffiness, especially in people who already have vein issues. Certain medications can also cause fluid buildup, including blood pressure medications, steroids, diabetes prescriptions, and hormone-related treatments. If your swelling started soon after starting a new medication, your doctor may need to adjust your dose. Sometimes swelling is a sign of deeper medical conditions, such as heart, kidney, or liver issues. These organs help move and regulate fluid. When they struggle, swelling can appear in the ankles or legs. It's very important to pay attention to changes. Swelling needs medical evaluation if it is sudden, painful, only in one leg, or comes with shortness of breath. These can be signs of serious problems like blood clots or heart strain. Supplements can help support vessel health, but they cannot cure the medical causes of edema. They should always be used as part of a complete plan, not as a replacement for medical care. Understanding the real causes of swelling gives you the foundation for safer, more effective relief strategies, which we'll cover next. Once you understand why swelling happens, the next step is learning what you can safely do at home to reduce it. Doctors often recommend simple daily habits that help improve circulation and move fluid out of the legs naturally. These are gentle methods, easy for most adults over 50, and they work best when done consistently. One of the most effective strategies is gentle evening leg elevation. Raising your legs above heart level for 10 to 15 minutes helps gravity pull fluid out of the lower legs. Use pillows or a recliner, whatever feels comfortable and stable. Short bursts of walking also make a big difference. Even walking inside your home for a minute or two activates the calf muscle pump, the natural mechanism that pushes blood upward. Doing this a few times a day can significantly reduce end-of-day swelling. Another helpful habit is doing light ankle rotations and foot flexing. Pointing and flexing your toes or making gentle circles with your ankles improves blood flow in the small veins and wakes up the muscles that assist circulation. A warm foot soak can also bring relief. Warm water relaxes tight tissues and encourages better blood flow. However, it's important to avoid extreme hot-cold contrast baths, as drastic temperature shifts can stress the vessels, especially in people with diabetes or nerve issues. Compression can help, but only when used correctly. Daytime compression stockings gently squeeze the legs to help prevent fluid from pooling. They are most helpful when you put them on in the morning before swelling begins. However, the strength and type of stocking matter, and you should always follow your doctor's advice on compression level. There are also times when compression is not recommended. People with peripheral artery disease, PAD, severe neuropathy, or certain skin conditions should avoid compression unless a doctor approves it. Compression should also not be worn while sleeping because lying flat changes how your blood flows, and too much pressure at night can restrict circulation. These home strategies are simple, safe, and recommended by many clinicians because they address the mechanical reasons swelling happens. When paired with good hydration, balanced eating, and periodic movement, they can significantly lower discomfort and help keep your legs healthier over time. Helpful nutrients that may support circulation. While supplements cannot cure the medical causes behind leg swelling or venous insufficiency, certain nutrients may gently support circulation and vessel health when used safely. These nutrients should always be seen as additions to good habits, not replacements for medical care. One commonly discussed nutrient is magnesium, especially in the magnesium glycinate form. Unlike magnesium citrate, which can upset the stomach, glycinate is gentle, calming, and well tolerated by most people. It does not flush fluid or repair veins, but it may help relax tight muscles in the legs and support overall comfort, especially at night. Many seniors find that magnesium glycinate taken in the evening helps ease tension in the calves and feet. Another supportive nutrient is vitamin C, which plays an important role in maintaining the strength of the vessel lining, called the endothelium. Vitamin C helps your body make collagen, the protein that keeps blood vessels flexible. This can support healthier circulation over time. Buffered forms of vitamin C are easier on the stomach, especially for older adults. A third group of nutrients is bioflavonoids, which include supplements like diosmin and horse chestnut extract. These compounds have been studied for their potential to support vein tone, reduce mild swelling, and improve leg comfort. However, these supplements should only be used with medical approval, especially if you take blood thinners, heart medications, or have liver or kidney issues. Diosmin is commonly used in Europe for venous insufficiency, while horse chestnut extract contains a compound called aeskin that may help strengthen vein walls. Safe dosing guidelines matter. Magnesium glycinate is typically taken between 200 to 400 milligrams daily. Vitamin C is often used in the 500 to 1,000 milligram range. Diosmin supplements vary, but many products use 450 to 600 milligrams daily. Horse chestnut extract is commonly standardized to 100 to 150 milligrams of aeskin per day. Anyone with kidney problems, heart failure, low blood pressure, or those taking diuretics, ACE inhibitors, or anticoagulants must speak to a doctor before starting any of these. Most importantly, it's essential to manage expectations. These nutrients are supportive tools, not cures. They may help your legs feel lighter or more comfortable over several weeks, but they won't instantly reverse swelling. Used cautiously and consistently, they can be part of a well-rounded plan for healthier circulation. The one nighttime habit that makes swelling worse. Earlier, we mentioned there is one simple evening habit that silently makes swelling worse for millions of older adults. And here it is. Too much sitting before bed with little to no calf activation. Most people wind down by watching TV, reading, scrolling on their phone, or relaxing in a chair. While this feels comfortable, it also means your legs are bent and still. When your knees are bent and your calves are not moving, the veins in your lower legs slow down dramatically. Since the calf muscles act like pumps to push blood upward, long periods of stillness allow fluid to settle in the ankles and feet. This happens especially at night because your circulation naturally becomes slower as your body prepares for rest. The good news? This problem has a simple solution. A gentle pre-bed movement routine can help move fluid out of your legs before you lie down. It doesn't require strength, equipment, or intense exercise, just slow, easy motion. A 5-minute routine that most seniors can safely do includes 1. Ankle flexing. Point your toes forward, then pull them back toward your shins. Do this 10 to 15 times. 2. Ankle circles. Rotate your ankles slowly in both directions, loosening the joints and waking up the lower leg muscles. 3. Heel raises. While holding a counter or chair, lift your heels off the ground and lower them gently. This activates the calf pump with minimal strain. 4. Marching in place. Marching for 20 to 30 seconds helps move blood from the feet toward the upper legs. 5. Gentle leg shaking. While seated, lightly bounce your legs up and down for 10 to 15 seconds. This helps loosen pooled fluid. These movements encourage the veins to push blood and fluid back toward the heart. They also prepare your legs for lying down when gravity no longer helps with fluid return. The key is consistency. Doing this routine every night before bed helps prevent heavy morning swelling and makes your legs feel less tight when you wake up. You don't need intensity, just steady, slow movement. By correcting this one simple evening habit, many people begin to notice softer ankles, less tightness, and improved comfort overnight. When swelling is a red flag, must not ignore. While leg swelling is common and often related to circulation or lifestyle, there are certain situations where swelling becomes an immediate red flag that needs quick medical attention. Knowing the difference can protect your long term health and prevent serious complications. One of the biggest warning signs is sudden swelling in one leg. If one ankle or calf becomes swollen quickly, especially if it feels firm, warm, or looks visibly larger than the other, this could indicate a blood clot known as a deep vein thrombosis, DVT. A clot can be dangerous because it may travel to the lungs, so this symptom should never be ignored. Another concerning sign is painful swelling with redness or tenderness. If the skin feels hot, looks red, or hurts when touched, this could be an infection or inflammation in the tissues. These conditions require prompt treatment to prevent worsening. Swelling combined with shortness of breath, chest tightness, or trouble breathing is also serious. These symptoms can indicate heart strain or fluid buildup in the lungs, especially in older adults. If this occurs, call your doctor or emergency services right away. Another red flag is rapid overnight weight gain, such as gaining 2 or more pounds in 24 hours. This can signal fluid retention from heart or kidney issues. It's a warning that the body is struggling to manage fluid levels, and early treatment is critical. So, how do you know when to call a doctor? Reach out to your healthcare provider. If swelling appears suddenly, only one leg is affected. Swelling is painful, red, or warm. You have shortness of breath. You gain several pounds quickly. Swelling does not improve within a few days. Swelling worsens despite lifestyle changes. Early treatment prevents complications. Many causes of swelling, such as venous insufficiency, medication reactions, heart issues, or infections, respond much better when addressed early. Waiting too long can allow small problems to turn into larger ones. Remember, your body uses swelling as a signal. If something feels unusual or concerning, your safest choice is to get it checked. Paying attention to these warning signs empowers you to take control of your health and avoid preventable risks. A gentle, practical, nighttime plan for reducing swelling. Managing leg swelling doesn't always require complicated methods. A gentle, simple nighttime routine can help move fluid out of the legs and make mornings more comfortable. This routine is easy to follow and designed with adults over 50 in mind. Start with your step-by-step routine. First, choose a time each evening when you begin to wind down, usually 30 to 60 minutes before bed. This gives your body a chance to transition into restful mode while addressing fluid buildup from the day. Next, focus on hydration timing. Try to drink most of your fluids earlier in the day. In the evening, take small sips rather than large amounts of water. This helps reduce nighttime pooling of fluid in the lower legs while still preventing dehydration. Then move into leg elevation. Find a comfortable position on a bed or couch and raise your legs above heart level for 10 to 15 minutes. Use pillows or a supportive wedge. This gentle elevation encourages fluid to return toward the chest where the body can process it. Follow this with gentle calf activation. Flex your feet up and down slowly, rotate your ankles, or perform light heel raises while holding onto a stable surface. These movements strengthen the calf muscle pump, helping push fluid upward and prevent it from settling in the ankles. You may choose to use optional safe supplements, such as magnesium glycinate or vitamin C if your doctor approves. These can help support vessel health and overall comfort, but are not required for this routine to work. Finally, adjust your sleep positions to support circulation. Sleeping on your back with a small pillow under your knees can reduce pressure in the legs. If you prefer side sleeping, keep your legs straight and place a pillow between your knees to maintain alignment. Avoid crossing your legs in bed, as this can slow circulation. This routine won't eliminate swelling overnight, but most people begin noticing improvements in days to weeks, especially when combined with daytime walking, proper hydration, and healthy habits. With consistency, your legs may feel lighter, less tight, and more comfortable each morning. A gentle nightly routine supports your body's natural circulation and helps keep swelling under better control, one evening at a time. Before we finish, I want to leave you with a message of reassurance and encouragement. If you're dealing with leg swelling, tight ankles, or that heavy feeling at the end of the day, please know this. You are not alone, and you are not doing anything wrong. Millions of adults over 50 experience the same challenges. Swelling can be frustrating and uncomfortable, but with the right knowledge and a few simple daily habits, you can make meaningful improvements. The steps we talked about today are not meant to overwhelm you. They are small, gentle actions designed to support your body, not stress it. You don't need to fix everything at once. Just start with one or two habits that feel realistic for you. Maybe a few minutes of ankle movement before bed, or raising your legs for a short while each evening. Even small changes can create steady, positive results over time. It's also important to remember that your health journey should always include your doctor or healthcare provider. Swelling can have many causes, and having a professional guide you ensures you're taking the safest and most effective approach. Don't hesitate to reach out to them if something feels unusual or if swelling comes on suddenly. Early conversations often prevent bigger issues later. Be patient with yourself. Your body has carried you through many stages of life and it's still working hard every day. These circulation supporting steps are simply gentle ways to give it some help during this next chapter. Improvement doesn't happen overnight, but with consistency, you may start waking up with lighter legs, less tightness, and more comfort as the days go on. If you found today's video helpful, I invite you to watch the next one, where we'll talk about 3 common everyday foods that quietly worsen swelling and inflammation in the legs. Most people eat them without realizing the impact they can have on circulation. Understanding these foods can make your results even better. Thank you for spending your time with me today. Take things slowly, stay safe, and remember that every small step you take is a step toward feeling better. You deserve comfort, confidence, and healthier legs, one evening at a time.